Hi guys, this is Dr. Nick from Centra Family Chiropractic, and I just wanted to create a video here for you guys to really talk about how we do things here in our office. And a lot of people relate chiropractic care to back pain and neck pain and things like that. And we get great results with those types of issues and symptoms. But what a lot of people don't realize is that if you were to come into our office here and follow us around for a week, you would see that there's hundreds of people coming in and out of here each week that are coming for issues not related to pain, all the way from little babies with reflux and colic and allergies to what's up, Jared? How's it going, bud? To ear infections and allergies and pregnancy-related issues and the birth process and so much. So, hey, Wendy, thanks for joining us. Good to see you. Anyway, so what we are doing with is, and the reason and the way we do things here in our office is obviously we're working with the back and the neck. And the reason that we work with the back and the neck is because the spine protects the nervous system. And the nervous system consists of the brain, the spinal cord, and all the nerves that come out of the spine. So what I really wanted to talk about today is if this little poster here, and we teach all our patients that come into our office about this. So if this poster here represents a nerve, I don't know if you can read that, but there's really three different functions of the nervous system. And if we were to just focus on pain or how you're feeling, then we're really only focusing on this 1/3, which is the sensory part of the nervous system. And that would include pain, numbness, tingling, things like that. But what we do here in our office is we assess the full spine, the full nervous system. And in doing that, I'll show you how we do that here in a second. But there's really two other parts to the nervous system. And that is autonomic control, or the autonomic nervous system. And that is all the control from the organs, blood vessels, and all your glands. And then the other part is the motor control. So that's your muscles and muscle tension and things like that. So when patients come into our office, not only are we assessing how they're feeling, but we're also getting a picture and a snapshot of how their body and how their neurology is functioning. So one way that we do that is that with what's called Insight scanning system. I'll be with you here in a second. Insight scanning system, and I'll show a video here in the future about what the scans look like or how we do the scans. But these are what the scans look like when we do them, and this is what we give to each patient. Now, I'm not going to go into detail about these, but this part right here, this is the part of the scan that we do that shows stress or tension on the autonomic nervous system. All right. Basically, white is good, green is mild, blue is moderate, red is a severe amount of stress and tension. The other part is the motor control. Okay, now that's your muscles, that's tension. And what we're looking at there is symmetry and asymmetry and muscle spasm and things like that. And that's what you see on this scan over here. All right, this being normal, this is this scan here. So again, red is tension, red is tight. That's what we're looking at with these scans. And the reason that we get such good results with patients with all sorts of other issues is not because chiropractic is a treatment for those XYZ symptoms, but simply because we are allowing the brain to communicate with the body through the nervous system by removing any stress or interference that we find on these scans so that their body can function like God designed it to. So that's just the message that I just wanted you guys to see today. I hope you enjoyed it. If you have any questions or comments, feel free to get a hold of us, call us, email us, whatever works for you. Thanks for tuning in, and we'll talk to you guys soon. Thanks.